This meeting is being recorded.
Good evening, everyone. My name is Robert Nolan. I'm the Chair of the Community Relations Committee of Health and Hospitals. I'm calling this meeting to order on September 13th, 2022 at 5 p.m. I want to thank you so much for attending our meeting this evening. So I hereby call to order the meeting of the Community Relations Committee of the Board of Directors of Health and Hospitals for this evening, September the 13th. I'd like to thank our chair, Jose Pagan, who pinch hit for me at the last meeting, and appreciate the work that he did and making sure we had a good Community Relations Committee meeting. Now, in accordance with Section 14 of the bylaws, committee attendance. If any member of a standing or special committee of the board will not be present at a scheduled committee meeting, the member may ask the chair of the board to request that another board member, not a member of that committee, attend the scheduled meeting and be counted as a member for purposes of quorum and voting. Now, Sally Hernandez Pinheiro has designated and delegated Dr. Michael McCray to be counted for the purposes of quorum and voting at this meeting. I'd like to thank Dr. McCray for accommodating us this evening at this meeting. I'd like to also add that two of our board members, Dr. Marthone, as well as Anita Kawatra, are attending this meeting in a viewing capacity only. Thank you so much for being part of our meeting this evening. I want to call now for a motion to adopt the minutes of the May 3rd, 2022 meeting, and I'll poll each of the members who are here who can vote on this matter. So first I call upon Dr. Katz.
Yes.
Yes. Dr. McCray?
Yes.
And I'm able to vote. I vote yes, so it is unanimous vote to approve the May 3rd minutes, and they are fully adopted. I want to start by informing the general public about the important information regarding the ongoing COVID-19 pandemic. Mayor Eric Adams today announced distribution plans for the new bivalent.
Bivalent.
You heard Dr. Katz. So it is said, so it is done. COVID-19 boosters, Pfizer 12 plus and Moderna 18 plus, through New York City Health and Hospital facilities, community-based healthcare providers, and pharmacies, in addition to being available through the at-home vaccination program for homebound or elderly New Yorkers. The updated boosters are far more effective at protecting against the latest variants and are recommended for all New Yorkers 12 and up, and those whose last COVID-19 vaccination was more than 2 months ago. New Yorkers can check with their providers to see if they are offering updated boosters or search the NYC Vaccine Finder for locations online offering the booster shots, or do so by calling 877-829-4692. Scheduled to present their annual verbal reports this evening are the following community advisory boards: Health and Hospitals COLA, as well as McKinney, Jacoby, and North Central Bronx. I'd now like to turn our meeting over to Dr. Katz for his remarks.
Thank you so much, Mr. Chair, and thank you for recommending to people that they get their new COVID booster. It's reformulated so as to be more helpful in responding to Omicron. I'm also very pleased that the rest of my update is not about COVID, but rather about how our world has other very important issues, including all of our 11 acute care facilities have been designated as baby-friendly. This is very important to us because of the strong evidence that breastfeeding leads to better outcomes for babies and for mothers, and we will always strive to have baby-friendly hospitals. We were pleased with District Council number 9, Local Union 1969, civil service employees, the International Union of Painters and Allied Trades, to announce the launch of a new apprenticeship program to train individuals for careers as unionized painters. These are great jobs for people, come with health benefits and union benefits, and we like making a pipeline for people to be able to both contribute important services to us and to launch their own careers. Kings County Hospital was again recognized as a Level 1 trauma center from the American College of Surgeons Committee. We're very proud of the excellent work that is done every day at that facility. New York City Health and Hospitals, along with the Department of Housing Preservation and Development, HPD, announced Just Home, a project to house New Yorkers with complex medical needs after they leave jail. Patients with medical needs such as congestive heart failure, stage 4 cancer, end-stage renal disease, and other illnesses that make placement in the city's homeless shelters unfeasible will be eligible for this program. It will offer much-needed affordable housing. It will create approximately 70 studio apartments and a 2-bedroom apartment for a live-in superintendent in a vacant building at 900 Seminole Avenue on the Jacoby campus in the Bronx. Correctional Health Services, a division of Health and Hospitals and the direct provider of health care in the city jails, will identify patients based on clinical and other needs. Just Home will address their needs through intensive on-site social services provided by licensed clinical social workers, dedicated peer workers, and specialists, as well as providing close access to the health services at Jacoby. The Fortune Society will act as the developer, manager, and social service provider for the project. Fortune's Castle Gardens residence, which opened in 2010, has become an integral and valued part of the West Harlem community, will serve as a model for Just Home. I hope many people saw the newspaper article. We made it to the New York Times science section showing that we are now able to test wastewater for infectious diseases. And as this is water that's leaving our hospitals, but as we've seen in the recent finding of polio in wastewater surveillance, it's an incredibly important tool for identifying emerging pandemics. Following a dramatic increase in web traffic, we've launched our new website, and COVID really showed people the value of having a comprehensive website where people can schedule services. I hope people will check in with our website and find that it's helpful, and we're always open to suggestions if people have other ways to improve it. We're proud to reopen the Neponset Adult Day Health Center in Rockaway Park, which closed for a long time because of COVID-19, and we reopened August 8th. And then finally, Elmhurst Hospital begins robotic surgery for hip and knee replacements. Using this advanced technology enables patients to recover faster and more effectively. Mr. Chair, thank you for your indulgence, and that's my report.
Well, thank you very much, Dr. Katz, for your informative report. We'll now hear from the 4 facilities that are presenting their verbal annual reports. Today's reports are brief and to the point, and we look forward to the presentations from each one of the hospitals that are on the agenda tonight. Our first report is from the Cabot Kohler Hospital, and I recognize Mrs. Gladys Dixon. Gladys, are you on a call? Mrs. Dixon?
Yeah.
Hi, how are you?
Good afternoon, everyone. Thank you for this opportunity to come and talk with you about our board's activities.
Go right ahead. We hear you perfectly.
Excuse me?
I'm sorry. We hear you perfectly. Please proceed.
Okay, thank you. I am Gladys Dixon, Vice Chair of the Community Advisory Board at Kohler. Knowing that the absence of our chairperson, I will be giving the report this afternoon. I have with us today our Chief Operating Officer, Mr. Catulo, also our liaison, Ms. Jovi May, I would like to start off in saying that due to the fact of the COVID virus, we all know we have not had a person-to-person meeting with the board members. However, we have been meeting virtually with our executive director and the other administration office heads, and also with our liaison on concerns and issues during this time of the virus. I would also want to say to you that we are very happy that our executive director has kept us informed of all the activities from HAC as they point to long-term care facilities and the virus. We have had the meetings, and he has given us information that is for the best health of our patients here at the hospital. We are proud to announce that we have maintained its 4 out of 5 star of the CMS. It makes us very important to know that the work that we have here at Kohler is very important and being recognized. We have at the same, with the pandemics, I'm kind of upset with and nervous, has been difficult for everyone here at the hospital. But at the same time, we have able to manage our patients, residents, their families, and visitors have been very upset, as we all know, the changes and with the isolations and the other actions that have been taken to follow the mandates from HHC. We are asking that we consider some of the concerns that we have very instrumental, that we can still continue with the meetings that we have been having and the fellowship that we have had with all that is concerned with our facilities. The restrictions are difficult for our residents, the visitors, and as for physically, mentally, and spiritually. We have been working hard with our recreation department and our auxiliaries to keep activities going on at the facility for our residents. We want to say here at this time that the board is very interested in going back to its activities, and until the end of this, with our COVID virus, we would like to ask you to maintain this form representing. I have at the same time with us here today, if there are questions, I would ask that they be directed to our executive director. He is here with us. And if not, I would ask this time, is there any questions that you would like to ask our board?
Thank you very much, Mrs. Dixon. Are there any questions from our board members? Dr. McCray or Dr. Katz?
No, but thank you for the report.
Thank you, Mrs. Dixon. I'd like to congratulate the hospital for the fact that all the Kohler staff have received their COVID-19 vaccinations. And it's something we shouldn't just walk on by and just assume that everybody got their vaccinations. But as I read here, that staff that did not receive the boosters have elected, they are tested twice a week. Dr. Katz, is that a mandatory rule throughout our system? That if you don't get that second group of, the boosters, that you must be tested?
The rule, I'm not honestly sure. It's slightly different for skilled nursing facilities.
I see.
I'm sorry. I'm not sure what the current rule is,
I shouldn't have
to
asked
be
the
sure.
question.
Yeah, I'm not sure.
Okay, but at least that's the rule at Kohler. And I'm pleased to read that at least is something that the staff is being tested twice a week to protect everybody who's at Kohler. I'm also pleased to read that the berm is being built to protect Kohler from future conditions, which can prove very perilous. So that's very good news also. And I noticed that you mentioned a priority area for improvement is communication. you're not the only hospital to mention that communication is an important and critical area that needs improvement. I think in life we will realize that we rise or we fail in our ability to communicate what it is that we need to say. I know whether we're at home or whether we're in the community, being able to be fully understood and have people fully understand what you're saying is critical and essential. And if you miss it at the very beginning, the whole conversation is lost. So I thank you so much for acknowledging that that's an issue and that your facility is working very hard to improve communication. With that, I want to congratulate you also on your 5-star ratings and nursing home staffing and quality measures. And with that, to thank your CAB chairperson as well as your CEO. And thank you so much, Mrs. Dixon. It's always a pleasure to see you.
The opportunity of sharing with you our report. I will take back to the board members our meeting today and the response that we have had. But keep us in mind, we are still working hard that we can resume our personal face-to-face meetings. Thank you again.
Thank you, Mrs. Dixon. Okay, we're going to move on now to our second hospital, and that is McKinney. Mrs. Deborah Tyndall. Mrs. Tyndall, I see your name up on the screen. Mrs. Tyndall,
Okay,
can you
I'm
hear
on.
me?
Yes, yes, I
Ah.
can hear you now. I had to unmute myself.
Very good. Welcome.
Okay. Good afternoon, everyone. Um, I'm so glad to be here this evening. As a past employee for 37 years with the corporation, and also I was the liaison for our CAB at Kings County, McKinney, and East New York. So I'm very familiar with the process. So I'm happy to bring the McKinney report to you this evening. September 22nd, and on behalf of the McKinney CAB, I would present this report and the staff at McKinney. On COVID-19, because of the amazing team at McKinney, all our residents were well cared for. That enabled them with a speedy recovery. We followed all New York State protocols where staff were sent home once they became positive, and positive residents were accommodated in a special recovery suite. In terms of the infrastructure and equipment, COVID is still ongoing, and some major projects are still on hold. For example, the in-house dialysis suite. That space is designated as the COVID suite, which takes precedence. The new morgue is completed. The nursing department has a newly renovated conference center. Patient safety and satisfaction. In alignment with our safety standards, we are in the process of remodeling residence rooms. Call bells will be placed very soon. New beds were brought along with night tables. The new state-of-the-art equipment for the rehabilitation suite. We also have always followed all New York State and DOH policies to ensure the safety of both residents and staff. Our residents are happy with the modified projects and program put in place by Therapeutic Recreation. Contact with families remain a priority. Carnations from the auxiliary were given to the residents on Mother's Day, and the auxiliary is always given to our patients, and we thank them very much. Frontline staff remains another priority, and they are commended for their tireless efforts in ensuring that care has never been compromised. Some frequent complaints were raised by the patients/residents, and that's only about the food. And that's been a little ongoing. We're not pleased with sometimes food. Some other things are the McKinney spirit is always present. It's amazing to witness the staff as they adopted each resident with love and compassion during that difficult period, which is the period of the COVID. The care and compassion from staff leave us as a community advisory board satisfied with the quality of care given to our residents. That ends my report. And if you have questions,
Thank you very much,
Thank you.
Ms. Tyndall. Are there any questions from our board
You're welcome.
members? No questions. Ms. Tyndall, could you just amplify your remarks about the concerns over food and how serious a problem that is?
The residents are concerned here. Sometimes breakfast be a little cold, and they're very concerned with the type of food that they're getting, and the request sometimes they don't get what they request.
Okay, so you brought this to the attention of your CEO, and hopefully when we hear from you next, you'll have better
Yes.
information. Would somebody like to respond to that? If not, then hopefully we'll have a better information, a better report when you present your next meeting.
Yes.
Thank you very
Yes.
much, Ms.
Yes.
Tyndall.
You're welcome.
Okay, we're going to move on. Is there a representative from Jacoby Medical Center on? Second call for Jacoby Medical Center. Then we will move on to North Central Bronx. And I know that Esme is here. Esme Satolo. Hi, how are you this evening?
Very good evening, Dr. Katz and the Board of Directors. My name is Esme Saturlo, representing North Central Bronx Hospital. And this is my report. North Central Bronx and Jacoby Hospital continue to operate successfully as a unit. We are proud to report in July 2022, the two facilities complete their first combined joint commission surveys since merging to become two facilities, one hospital. The joint commission surveys were impressed with the hospital best practice to ensure equity for all patients and our staff members. We are thrilled to announce North Central Bronx as being designated as a baby-friendly hospital for the second time, meaning staff had worked diligently to uphold and implement the 10 steps of success breastfeeding. NCB has been a baby-friendly hospital since April 2016. Also, the facility recently received the Joint Commission certification for prenatal care. Certification proves the hospital has not only met but exceeded standard of care for maternal and fetal and newborn health. Additionally, the North Central Bronx nursing team is on the pathway to excellent journey with the American Nursing Credential Center. The program recognizes health organizations that demonstrate a commitment to establish the foundation of the healthy workplace for staff. As we continue battling COVID-19 pandemic and the offset of an emerging monkeypox virus, our facility works cohesively to implement hospital preparation strategy to continue providing the safe environment for patients, employees, and guests. Our CAP continued to build through its stakeholder network for elected officials, community boards, and other stakeholder groups. Below our patients are relayed changes that have been made at Jacoby as they pertain to COVID-19 and infrastructural equipment. We have continued to stand up and support our patient, staff, and community with our COVID-19 vaccination, testing, and treatment option. The COVID-19 vaccine first began available in December 2020, and since then we have been providing comprehensive testing and vaccine for the Bronx community, where we serve and mitigate the spread of contagious virus. Our monkeypox clinic is now open. North Central Bronx continue to serve as a safe haven pinnacle COVID-19 health and resource facility in the Bronx. The equipment for North Central Bronx has acquired many clinical need new equipments over the past 12 months, including 2 new ultrasound machines in the radiology, 3 new registration within departments, New York republished CT scan, rheumatologist ultrasound, the Heron call bell system installed on patient unit, mammogram machine sterilization, central sterilized. NCB has been awarded 38 million energy grant to replace 7 elevators, 6 air handlers which control temperature and humidity. The 3.8 million grant was awarded to refurbish 4 of the operating rooms. Project is provided infrastructure and revitalization for NCB over 100 million of investment, including the 4th stage of energy efficiency project, fire alarms and sprinkler replacement, and multiple improvement to clinical areas throughout the facility. Freight elevator repairs in progress. Here is my vice chair to give you the rest, Mr. Dolan.
North Central Bronx average HCAHPS scores of 70% have been maintained between the third quarter of 2021 to the second quarter in 2022. The adult and pediatric emergency departments maintained an average overall score of 83.22% between the third quarter in 2021 to the second quarter in 2022. The inpatient adult behavioral health department has maintained an overall score of 73.92% between the third quarter in 2021 to the second quarter in 2022, increasing each quarter, most notable in the second quarter of 2022 with an overall score of 79.48%. The medical practice has maintained an overall score of 86.23%. Recommended best provider score of 88.53% and rate provide 0 to 10 score of 83.90% in the third quarter of 2021 to the second quarter of 2022. Improvement strategies include eye care refresher and tailored training and orientations, focus on employee engagement and wellness, sharing quantitative and qualitative data to highlight the voice and experience of our patients. Overall, there continues to be a system and hospital-wide focus on care experience and employee engagement and wellness. Frequent complaints raised by patients. Communication remains our greatest challenge and is not isolated to any specific area, rather a global issue. All complaints or grievances that are indicative of quality and care allegations of abuse issues are immediately referred to the departmental chair, chief nursing officer, and director of nursing for the area involved, as well as the area administrator for evaluation and plan of correction as applicable. In addition, all quality of care cases is analyzed by the grievance and committee, which meets monthly, looking specifically for any trends or processes that may be contributory, as well as any structural inequities of racial, gender biases. Plans of correction, when required, are submitted to and referred by the grievance committee. Quality of care issues are discussed in all appropriate venues, staff meetings, local performances, and or quality improvement meetings, as well as the hospital-wide performance improvement committee, departmental meetings, and when deemed necessary, the medical executive committee. The end of the report.
Thank you, Mr. Dolan, for your patience and everyone on the board.
Well, I'd like to thank both of you for presenting your report on behalf of the North Central Bronx. I'd like to ask if there are any questions from Dr. Katz or Dr. McRae.
Just to say, as you said, we've been so happy at how the collaboration between Jacoby and NCB has gone and the critical role NCB has played in enabling patients who might have once stayed for hours and hours in the emergency department because there was no bed, now getting humane, thoughtful care at NCB. We're very pleased.
Thank you very much, Dr. Katz. And I want to say that I was going to express similar remarks because all I've heard is the very improvement of services at Jacoby Hospital because they're able to transfer patients over to NCB, those patients who are eligible, then to alleviate their load and know that they're going to get excellent medical care at North Central Bronx. And the distance away of the two hospitals is probably no more than 2 or 3 miles. It's just that Bronx River Parkway that gets in the way and presents some difficulties from time to time. We all know that. So, but I'm very, very pleased to see that that has worked out so well and that also you've been designated as a baby-friendly hospital for the second time. We know how critical that is in Bronx County, which is the most unhealthy borough in the entire city, not just for our youth and for our seniors, but for expectant mothers and mothers who give birth and do not survive as mothers do in other counties in our city. So we have a double responsibility, if not a triple responsibility, to take care of expectant mothers and after they give birth to take care of their postnatal care. With that, I see that you've also raised the issue of communication. I'm glad that you said that communication is a global issue. It certainly is. And I know that Mr. Jones is working very hard along with Chris Mastromano to improve that. So I want to thank both of you for reporting tonight, and we wish you well up at North Central Bronx.
Thank you so much.
All right.
Thank you.
Take care. Now we'll move back, and I will recognize Mrs. Emily Sanchez, who is going to be speaking to us tonight as a representative of the Jacoby Medical Center. Emily, are you there? Emily Sanchez, are you there, Emily?
Ask her
wait
to
a few moments.
unmute.
Oh, very good. No.
Well, that's something I could have said. That's true. Emily, are you able to hear me? This is Bob Nolan. What do you suggest?
It's unmuted, but we can't hear her, so.
Is there a phone number we have, or in the phone number you can call at Jacoby?
Let's postpone to next meeting, please. She's having technical difficulties. I can see her blinking it out.
So we will not be able to have that report tonight then.
We postpone to
Okay.
next meeting.
We'll postpone, we'll add it to the next.
We'll add it, yes. So due to the technical issue that stands in the way, we will not take up the Jacoby Hospital report this evening. I would like, though, to recognize one of our colleagues who has now become the new Council of CAB's chair, Ms. Karen Dixon. Ms. Dixon, are you able to hear me?
Yes, good afternoon, well, rather good evening, everyone.
Hi, it's good to see you. And congratulations on your election. When were you elected chair?
In June,
In
this
June.
past June.
Well, you're a veteran by now. I look forward to calling you, and I'll give you a call this week once I obtain your phone number. I look forward to working directly with you in the months and years ahead.
Definitely, thank you. I look forward to it as well. Good evening.
You're
and Have
welcome.
a great rest of the day.
And we're going to move on with our agenda. Is there any old business? On the new business, I'd like Dr. Katz to update us on the changes that have come about due to the governor's action just, I think, last night regarding our meetings and meetings that have been held virtually, and Dr. Katz has an update on that.
Yes, thank you, Mr. Chair. Essentially, what the governor, thank you, Calicia. Essentially, what the governor has done is returned us to a pre-COVID era. It's not so much a new action as that she has let the emergency action lapse. So now we return to the way it was, which is under the public meetings law. Board members need to be present in order to count toward quorum or to vote, and all staff members as well will be present at the meetings to present. So, I mean, the nice part is that we've all missed being together and seeing each other up close, and we'll be very happy about it. I know people have gotten used to some of the ease with which you could stack meetings close together, and we'll all have to get used to going back to having a certain amount of transit time and the challenges that come with that in a tight urban area. But overall, right, it's our world returning back to the way it was. So I think that's a good thing.
In many respects, we're happy the world has returned
Yes.
to the way it was, even though we've got to change our own ways of operating, and but we'll be able to see each other more often and get more done. I think we'll all agree that when we see each other, get a chance to talk to each other, we can get so much more accomplished. With that, thank you very much, Dr. Katz, and I will adjourn this meeting of this committee at about 5:44 p.m. Thank you so much. We'll see you in a couple of months.
Well done.
Thank you, everyone. Good evening.
Good evening.
This meeting is no longer being recorded.